X-ray, and I think this is the best one. Good X-ray. Somebody has drawn it, the hip bone. Now you know that in the lower abdomen, pelvis, lower limb, upper limb, if you just concentrate on the, thank you, just fix it up. Thank you. You have seen already the chest of the X-ray, and so we will see here mostly the bones and joints. Two things you can see in the X-ray, and in most of the X-ray it is AP view and lateral view. In the chest you see PA view. Any X-ray comes from posterior to the anterior. It is anterior, kullo AP except chest. Except in the thorax, it is PA view. Otherwise, in all of them, it is AP view, anterior-posterior. And I have told you why you call anterior-posterior, posterior-anterior depends upon the X-ray you put where, and the X-ray coming from where. If it is X-ray come from behind, it's called PA view.
Behind the
From behind, posterior, anterior. And Baden Kullo, it is AP view, anterior, posterior view.
This is
Yes, this Kullo AP, except
Chest.
correct. AP, and here also because they are mostly bones, we call it the lateral view also. So usually we see two types of the X-ray, either AP or lateral. In some position you need oblique view because there are many bones and you want to focus one bone, you can take the oblique view also. So three things are there here. Now the bones we'll concentrate, bones one by one, and then the joints. These are the lumbar vertebrae, you know already, and these are the spines, what you see. These are the transverse processes. Transverse processes are small, the spines are more prominent. This is intervertebral space. Intervertebral, leaving aside the ribs and things above, lower 5 lumbar vertebrae, and then you can see the sacrum. Sacrum, here is the promontory of the sacrum, the anterior border of the sacrum. So, sacrum, lumbar vertebrae, okay, transverse, the spinous process, transverse process, intervertebral space, okay, in transverse process is enough. But because the transverse spinous is this. Transverse process in the lumbar vertebrae is small. You know, it's not like thorax or other things. So you can see only some part overlapping. So that is about the lumbar vertebra. Then the sacrum. This is the promontory of the sacrum, and these are the sacral, anterior sacral foramina. Body of the sacrum all fuse to make one bone. A khamsa bone, a fuse to make one bone called sacrum. Okay. You know, there's some abbreviation. Sometimes the first sacral fuse with the fifth lumbar. It is called lumbarization of the sacrum. Common abnormalities. Sometimes the sacral one is separate from the sacral bone. It is called sacralization of the sacrum. So two words, lumbarization and sacralization.
Depends on what?
Huh?
Sacralization.
Fusion, depends on the fusion. Sometimes the sacrum fuse with lumbar 5. It is called lumbarization and sacralization. And the second is point is sacral 1, sometimes separate.
From other.
It's called lumbarization. This is a lumbarization.
When it's separated, it's called
sacralization.
liberalization.
Yes.
Fused
Fused with the
sacralization.
fused is called sacralization of the lumbar vertebra. So these two terms are sometimes you find this is a common problem for the back pain. Patient comes to you with the back pain and you see that there is and take the X-ray. So these are the things. But what point you have to see now in this is the sacrum and the coccyx here. Sacrum coccyx. Now and this is the joint between the sacrum and the hip joint. It's called sacroiliac joint. Sacral. So here, lumbar vertebrae, intervertebral disc, sacrum, okay, coccyx, and then this is a joint called sacroiliac joint.
Can we say sacroiliac?
Sacroiliac joint.
Yeah.
This is the normal term. Sacroiliac, from between sacrum and ilium of the hip bone. Yes, sacroiliac joint. Sacroiliac joint. You know, this joint is very important for the childbirth. The sacroiliac ligaments are very strong, and these joints becomes relaxed during childbirth, so that it becomes loose and gives space. This space is the joint space, and is space between the two joints, the two bones. This is a joint space. This is the crest of the ilium. Okay, iliac crest. Then here, anterior superior iliac spine, anterior inferior iliac spine. Please note down these two. Very important. Anterior superior, anterior inferior iliac spine. Then this is the acetabular cavity. Acetabular cavity. And this is again a joint space, because the cartilage in between does not comes in the picture. It is radiolucent, no effect. Just like here, joint space, here you will find joint space. This is the head of the humerus. Head of the, femur. Head of the femur, neck of the femur. This is the greater trochanter. This is the lesser trochanter. So the important landmarks here you should identify, because they are important in the dislocation or fractures. Okay, so these things are, you should commonly know their position. Remember, sacroiliac joint, iliac crest, okay, anterior superior, anterior inferior iliac spine, and this is the pubis, pubic symphysis, pubic tubercle, pubis. This is the ischium. So ilium, ischium, and pubis. This is the obturator foramen. Obturator foramen. And you will see one thing very important is that lower border of the neck of the femur makes a line in continuous with the upper border of the obturator foramen. Okay? This is called Shenton's line. Please note down. Shenton's.
Where is the location?
The lower border of the neck continuous with the upper border of the obturator foramen. Other obturator foramen.
Okay.
You see this?
Connects the
Yes,
femur with
it is
the...
a line with the lower border of the neck with the upper border of the obturator foramen. This is an important line written in the snail also. This Shenton's line. This line is important for dislocation and fracture of the hip joint. Hip joint, maslan this, commonly the neck of the femur. If the neck of the femur is fractured, you have this line become disrupted. It's not continuous. Maslan this is a line formed by two bones. Lower end of the neck and the upper border of the obturator foramen, continuous. But if there is a fracture, the line becomes disrupted. So this is the importance of this Shenton's line. This is the upper border of the foramen, or this is the obturator foramen. This is a continuous line, and this line is dislocated when there is a fracture of the bone. So here, what you have to see here, the sacrum, joint, iliac crest, anterior superior, anterior iliac spine, then obturator foramen, pubic symphysis, pubic tubercle. Okay? The head of the femur, acetabular cavity, sentence line, greater trochanter, lesser trochanter, intertrochanteric crest, intertrochanteric crest. So please see, make sure about these upper end of the femur. Okay, head, neck, greater trochanter, lesser trochanter, intertrochanteric crest. In the hip bone, identify 3 bones: ilium, ischium, and pubis, iliac crest, sacroiliac joint, and that's when the common things here. Somebody might makes a point arrow here. What is this? Anterior and iliac spine. What is attached here? Second question.
What this?
What's this?
Attached here.
Touch.
Anterior superior iliac spine. Identify this. What is the attachment here?
Lungus.
Go on.
Anything else? I'm giving you. What is this? Greater trochanter. Name 2 muscles attached here. Something question like this. Or lesser trochanter or intertrochanteric line. These are the important points in the pelvis and the upper end of the femur. Upper end of the femur, head, neck, greater trochanter, lesser trochanter, intertrochanteric crest. Make sure these 4, 5, 6 points here. And in the hip bone, I have told you what you have to see. Hip bone, iliac crest, spines, anterior superior, anterior inferior iliac spine, sacroiliac joint, pubis, obturator foramen. This is the acetabular cavity. So this will do with the second is I wanted to show you the knee joint. This is the this is the lateral view. This is the some problem with the fibula, but this is the knee joint. Just make it. Just put it.
الطماع.
Just giving you 2 important exercises. I have separated. You can revise it after. No problem. I'll do it. That's all. This you can identify the knee region and the lower half of the femur. Okay, this is the 2 epicondyles. Okay, supracondylar ridges. This is the adductor tubercle on the medial side.
What?
Adductor tubercle. Adductor tubercle. Above the medial epicondyle, you have a small from here. This is the last attachment for adductor magnus. You remember, adductor magnus is a big origin from the vera, linea aspera, and other things. But this is the adductor tubercle. The 2 epicondyles. These are the 2 lower ends, medial epicondyle and lateral condyle and medial condyle. These are the epicondyles, supracondylar ridges. This is the upper end of the tibia. And this is the intercondylar ridge, 2 spines, tibial spines. This is the again medial epicondyle and lateral epicondyles. Okay, here some dense you see tibial tuberosity. In some it is more, in some it is less. Tibial tuberosity, epicondyles, condyles. Condyles of the femur, condyles of the tibia. Okay, this is the joint space, knee joint. You know there are 2 semilunar cartilages which are present here, and medial one is more important because medial ligament is attached, and when you make kick by football or playing, it is the medial side which is usually damaged, here and here also, because the stress or pull on the medial ligament will damage the medial meniscus also. There is a cartilage here, it's called meniscus or semilunar cartilages, medial and lateral. Medial is more important for the injuries because medial is fixed to the ligament also here.
Internal.
Yes. So these are the 2 epicondyles, and these are the epicondylar area. These are the condyles of the tibia. These are the condyles of the femur. Epicondyles. and this is the intercondylar area with two tibial spines. Tibial spines. This shadow you see is the tibial tuberosity. This is the upper end of the fibula. Upper end of the fibula, and this downwards, you know, this tibial joint here, a small joint on the lateral side. There is a facet. On the back of the epicondyles, there is a facet. So just identify this area, and you have to maybe name this area A and B. Name A and name B, or the something like, you know, anterosuprailiac spine. Name the structure attached to it, or iliac crest, or like that. The importance of this. One more thing I'll tell you, that this is what you see in adults, any above 25 years. But in less than 25 years, sometimes the epiphysis does not fuse. Okay? So sometimes you have a separate, there's a gap between the lower end and here in this part. So if I get some X-ray, I'll show you. Just identify the head of the fibula, the shaft of the fibula, tibiofibular joint. These are the condyles of the tibia, two epicondyles, intercondylar space.
Epicondyle.
Hmm?
Epicondyle.
Epicondyle, huh? This and this. Okay? Hmm?
What's the structure that's mentioned deep?
Here?
Yeah.
Epicondyle.
Epi.
Yes.
What's the
Medial, lateral fibula. Fibula lateral.
And what age?
This is adult.
head of
Head of the fibula.
Head of
Fibula. This will not be put, don't worry about it. This is the same, the lateral view. This is the AP view, and this is the lateral view. Lateral view, same things you can see. This is the patella, lower end of the femur, and the condyles of the femur.
Right.
This,
Condyle.
and this is the tibia, upper surface. This is the knee joint, patella. This is the, again, head of the fibula. Okay? So this is the lateral view.
This is the right one?
I think it is the right one because this is overlapped slightly onto the back side. So this is on the right side. Not straight, because if you see here, it goes behind. Okay? Any confusion? AP and lateral view of the knee joint. This is the lateral view of the. This is again very important. You know, you have to identify at least the bones here.
We didn't take the foot yet.
We haven't taken it.
No problem. Just identify the bones slowly. I will tell you. You can again repeat it. No problem.
Repeat it again.
Maybe you see these bones here. Bones of the foot you have not done.
No, thanks.
Okay, I'll just show you. You can see it later. This is the lower of the tibia and fibula behind it. Now, what you see in the bones of the lower limb, you can divide in three groups. Tarsal, metatarsal, phalanges. Tarsal, metatarsal, phalanges. Just like here, you see carpus, carpal bones, scaphoid, lunate, triquetrans, carpus, metacarpal, phalanges. And again, Talata group. In the tarsal bone here, you see the calcaneum, biggest bone, heel. You put your heel here, calcaneum, talus. Okay? Then on the lateral side, cuboid, cuneiform. I'm sorry, the navicular and talata cuneiform. How many bones? Talus, calcaneum, navicular, talata cuneiform, and cuboid. Lateral side. This is lateral side. This is tuberosity of the fifth metatarsal. You know, peroneus longus, peroneus tertius is inserted here. Peroneus tertius. This is the tuberosity of the fifth metatarsal. These are the metatarsal bones. metatarsal, and these are the phalanges. You need 2 and 3.
Proximal distal.
Okay?
Proximal.
Proximal and distal and middle.
Metatarsal.
Metatarsal, this concept. And important here, there is a tuberosity on the 5th metatarsal. See tuberosity here. Yes, tibials anterior and things are attached on them. The peroneus tertius is attached. You will learn more about it.
Doctor, can we see the malleolus here?
Malleolus, yes, this is the lateral malleolus.
Lateral or medial?
I think this is the lateral because the cuneiform more on the medial side. This is the medial.
Medial.
Big one. Lateral is small, it's found by the lower end of the fibula. So these are the 2 malleolus. See here? This is probably the oblique view, one side. This is the fibula, lateral malleolus, other medial malleolus. And the 2 malleolus make the joint, tibiofibular joint. And this tibiofibular joint sits on the superior surface of the talus, subtalar joint.
Malleolus, think so?
Yes, medial malleolus and lateral malleolus
Okay.
make the joint,
Okay.
tibiofibular joint with the ligament. And this scullo sit on the talus, upper surface of the talus, and make the joint, subtalar joint. You make this movement, dorsiflexion and plantar flexion, mostly on this. So just know about the bones, details you will know when you will study. This is again calcaneum, this is the talus, cuneiform, this is the medial side, this is the 5th metatarsal, is identified by a tuberosity. This is the cuboid. All the bones you can see again here. Okay. This is the upper surface of the talus. This is the head of the talus. And you see that whole thing is sitting on the talus to make the subtalar joint. There is transverse metatarsal joint, subtalar joint. This is the calcaneum. Heel. Talus, calcaneum, okay, cuboid, navicular, and thalata cuneiform is overlapped on the other side. So just revise these X-rays, and starting from the first one. So these are the oval, okay. Then I show you this as again important, these 2, and then the identification of the bones. Just identify the bones here in the joint. I just leave it here. You can see these X-rays. I told you the type of the questions which are usually asked. Remember Shenton's line. Yes. Shenton's line